Our mental health doesn't exist separately from our experiences and the environment we live in. Unstable housing, financial insecurity, poor physical health, lack of employment and isolation from our family and friends can all affect our mental health and make it harder to manage the symptoms of mental illness. We all want to live in a place we call home, with the people and things we care about, doing the things we like to do, in communities that care. And when we're unwell, we want to have access to the support and professional help we need. GPs and mental health professionals do great work to meet people's clinical needs, but there's a limit to what they can do. The best treatment in the world won't fix a damp and cold house or magic away your money worries. As a charity, we campaign to bring about change, including high-quality housing solutions for those in need, increased employment opportunities, and a fairer welfare system. But we also know that the services we and others provide, including the NHS, also need to change. This new way of working will help to ease the burden on social care and reduce pressure on the primary care system by supporting doctors and mental health professionals. Our pioneering Communities That Care model sets out a long-term vision, which means we treat people like the individuals that they are. We want care providers to work in a more joined-up way, so people can find the support they need much more easily and quickly. It works on the principle of no wrong door. This means in practice that a person's needs are addressed regardless of where they first look for help. For example, if someone living with mental illness goes to the psychiatrist or psychologist but wants advice on housing, they only need to share their story once, rather than having to repeat difficult or traumatic experiences to multiple people in different services. This can be a huge barrier to seeking support. It also means that people can access help more quickly, rather than hold for hours on phone calls, wait for letters, etc.
If you're not getting those core needs met and you're not having your foundation, then how can you expect anything else to improve? You need stability, finances, you need a home, you need consistent feeding, you need this, that and the other. And so many people with mental health issues or issues don't have access to this. And I felt really lucky when I was able to gain at least half of that through Rethink, and then I could just start to find the rest myself.
This is a new model that depends on everyone working differently. People can automatically come to the right place and be supported as a whole person. We can achieve so much more by working in partnership. This crucially includes asking people with lived experience of mental illness to co-produce services so that we provide what people actually need and want, so they don't just survive but thrive. It is the future of mental health care. Our collective challenge is to make it a reality across the country so that everyone who experiences mental illness lives in communities that care.